Hello everyone. Today I'm going to discuss about the consciousness. So what is consciousness? What are the altered consciousness? How we are going to assess the consciousness if they lost any consciousness. So with the consciousness we are going to found the how much they having the problems related to consciousness, or maybe is it drowsy or stupor or cloudy, or in case of delirium, in case of any amnesia, loss of memory, or any coma patients, how we are going to check. If anybody get any like a dementia, Alzheimer's, how they are going to get the loss of memory. So how much memory they are going to get the problem. And we are going to discuss all these things in this consciousness and also altered consciousness and also this assessment. So coming to the consciousness, actually what is mean by consciousness? Consciousness is the state of being aware of and also response to one's surrounding. So that means they should aware of the surroundings. So where are they? So what they are doing, what state they have, how they are going to respond to the stimulus. So these are all these things related to the consciousness. It is, if you see the definition, the state or activity that is characterized by sensation, emotion, violation, or thought, or mind in the broadest possible sense. So they have to know about all the sensations and emotion, violations, and also thoughts about the. So it's going to be all the feelings. So they have to understand clearly something in nature that is distinguished from the physical. So it should be from the physical and to the nature. It should be differentiate. So what type of the sensation, what think they are doing, where they are, how they are thinking. So all these things also comes under the consciousness, the state of being. So coming to the some abnormal consciousness. So how the consciousness is going to be altered, in which condition the consciousness is going to be abnormal. So if you see the state of consciousness usually altered in case of head injury patients due to depression of the function of the bilateral cerebral hemispheres. So everything is controlled by the brain. So especially this consciousness. So it's including the language and also memory. So all together controlled by the brain. So if any damage in the brain, especially to dysfunction of the bilateral cerebral hemisphere, so it may use the depression of the brainstem functions. So these are all controlled by the brainstem, and due to the destruction of the brainstem activity, so they may chance to get the altered the consciousness. So what are the altered consciousness? So many different type of altered consciousness. So I'm going to explain is one by one here. So what is the altered consciousness? It's the first one is the coma. Coma is defined as the complete arrest of all the cerebral functions, state of unresponsiveness to even strong stimulus, noxious term stimulus. The eyes are going to be closed. If any person with any accident or maybe head injury or any other because of the hemorrhagic stroke or because any like a any trauma or because of the anything also, if the person is not responsive to the stimulus, if you give the noxious stimulus, the painful stimulus, if you pinch on the hand, if you pinch on the sternum, if you pinch here on the supraorbital region, so anything also there is no response. If you tap also no response. If you pinprick also no response. So the person is going to be complete loss of the all the cerebral functions. So because of their loss of the brainstem activities, so they are unable to respond. Even they are unable to open the eyes. No, like a opening eyes, no motor response, no verbal response, no talking. So in there is no complete response. Loss of all the functions is called as the coma. So this is the serious degree of the loss of consciousness. So next one is the stupor. This also altered consciousness. This is state of overt sleepiness, and even on the walking of the patients appear to be drowsy and also disintegrated in the surroundings. So the person is going to be the overt, like a state of overt sleepiness. So how in the deep sleep or is unable to wake up, how they are going to be walk, how they're going to respond. So is commonly seen in the stupor, which is called as the stupor. So in this one is the person is going to be looks drowsy and also disintegrated in the surroundings. So that means they are not going to be observe anything to the surroundings. So there is no communication, proper communication with the surroundings. If you call or if anything also, they're not going to be response like a overt sleepy. So that is called as stupor. So this also, okay, sorry, stupor. And also next one is the delirium. So delirium is this is often noted. So when the patient comes out of the state of the consciousness, unconsciousness. So here the patient appears to be disoriented, fearful, will often misinterpret the sensory stimulus. For example, if any patient met with any accident or any motor vehicle accident, and maybe bike or car, or if the person fall from the heights, suddenly the sometime after the unconscious, the person is going to get up, getting the consciousness. After wake up from the injury, after get up from the some period, for example, 2 minutes or 3 minutes after loss of consciousness, the person becomes the normal response. That time is going to be very fearful and also disoriented. Whatever you give the stimulus, so he's not going to be, is not communicate properly. And also here is going to, the patient is disoriented. Whatever you ask, is not going to orient. That means he's not going to communicate properly. So this is going to be like a delirium, is going to be fearful of a state, or maybe there is no response after the unconsciousness. If the patient comes to from the unconscious, the next stage is the delirium. So the stage will be some short durations. After they get recovery from the the shock, so is going to be become the normal. And also next altered consciousness is a clouding of the consciousness. So this state of the quiet confusion is a distractibility, fault memory, and also slow response to stimuli. So they are going to be like a blur appearance. Like a stage is going to be like a, whatever you ask, they are going to be stare on you or something that they cannot understand. They will be in the confusion state. And also the distractibility. So whatever they are going to distract, you are talking something, they are going to look at something. So they are not concentrate. And also they lost the memory too. And also slow response to stimulus. If you ask, okay, hello, what is your name? And also they are going to respond very slowly. Okay, where are you now? They're going to respond slowly. So this type of this altered consciousness commonly seen in case of any if any cerebral dysfunctions or cerebral damage, so in may chance to get this loss of consciousness or altered consciousness. So next one is the sensory motor like a consciousness. So here is going to be two types of the sensory. So in case of the head injury, so in case maybe if anybody having damage in the cerebral functions, especially if any brainstem, midbrain, pons, medulla oblongata damage, is either maybe brain tumors or hemorrhage or any stroke or in head injury, so they may chance to get the altered sensory motor consciousness. So these are the two types categories, two variants. So one is the decerebrate rigidity and also decorticate sensory loss. So that means what is mean by decerebrate? So this decerebrate means because of the cerebellar involvement, so they may chance to get the abnormal posture, the response is also going to be abnormal. If you see decerebrate, so because of this is the damage above the corticals area or midbrain area. So if a damage in the midbrain, so or maybe is the damage the cortical control. So if it is because of the damage above the brain and also midbrain area, so they are going to give the response, not going to alter the conscious response. And also the person is going to be like a extension of the upper limbs and also extension of the lower limbs. So whatever you, if they give the movement or if you pinch or if you give the like a stimulus, strong noxious stimulus, so the person is going to becomes the like a hyperextension position of the upper limbs and also lower limbs. So these going to be symptoms are going to be extension posture, and also jaws are going to be clenched, neck is going to be retracted. So this is going to give the extension of all the parts of the body. This is the most common symptom in case of the head injury. So especially if the damage above the midbrain level. And also, and this one is going to, if the damage in the brain and also above midbrain levels are intact, so damage of the cortical control. So here is going to be corticals are going to be involved, the corticospinal tracts, and also these are going to be rubrospinal. So damage of these things also, they are going to get if you give any stimulus, the body becomes the flexion of the upper limbs and also extension of the lower limbs. Decorticate rigidity is called as a decorticate. So these postures, so this altered consciousness we can found in case of the head injury. So these are the sensory motor altered consciousness.